everyone, my name is Vanessa Peixoto and I'm here today to go over my pocket guide that I made this semester for my class Primary Care Family 1. And I'm gonna go over each topic that I decided to include on this pocket guide. Alright, so to start, I have this index over here where I divide each one into topics that are gonna be using throughout my clinical. It's just like, so I have this quick reference guide, and so I know where to go, which dividers like 1, 2, 3, and so on and so forth. And to start, I put under respiratory the topic that I put, as you can see, respiratory 1. I put like the pulmonary function test, just like a little quick note so I can refer to. And also I put some bullet points about risk factors in classification of like daytime and nighttime symptoms, so you know the severity of the asthma. Also like tests, studies to diagnose and also differential diagnose, and how to treat the acute asthma exacerbations. And this part over here is just like a daily dosage of inhaler corticosteroids in adolescent and adult. And so all that. And also like how to assess asthma on children from 0 to 4 years old. And then also 12 to adult, what you're going to be looking for. And this is just like a diagram of asthma exacerbation. So what's the treatment, what the route you're gonna take it. Over here I think was also a nice diagram to see like step 1, 2, 3, 4, and 5, what you're gonna be adding on the treatment. And this is another way of seeing as well, like how you're gonna, what's your next step if a patient come in with exacerbation or if the medication is not working. This is a COPD evaluation management guidelines that I put it as well. And the gold, like gold 1, gold 2, gold 3, gold 4, like after you do the pulmonary test function, so you can test for the like severity of the COPD. So it's the A, B, C, D. And also like a little diagram pathway, so I know what kind of treatment I'm gonna be approaching depending on which group of my patient category my patient is gonna be, if it's A, B, C, or D. And I decided to put this Pneumovax, like a little cheat sheet so I can refer to like when I'm gonna be giving this vaccine and who am I going to be given to, like depending on the risk. And this is just like a recommendation from the UpToDate that I thought was cool too. It's the same thing but different way to visualize. And this is bullet points of risk factor of OSA, which is obstructive sleep apnea. So symptoms, treatment, recommendation, and there's a little algorithm that I can refer to. This is continue to assess COPD, is the ABCD assessment of the symptoms, and also like the guidelines for lung cancer screening that I decided to put it. And then we're gonna get into contraceptive. So this is just like a quick start algorithm. So people that you're gonna put if they're interested in pill, patch, or ring, or progestin injection, or IUD, or implant. And bullet points about the benefits of progestin only pills. They talk about the benefits and what's the side effect or the downside of that. And combined hormonal birth therapy control methods, which is your estrogen and progestin pills, and what's the benefit, what's the maybe side effect of it, and possible side effects. And then I get into cardiac, which I have like some you know, notes that I can just quick refer to about like type of medication and what a little bit of side effects of it. This is a little bit of cheat sheet about like hypertension, primary, secondary. And over here, I decide to put this quick, you know, algorithm. So of like a major recommendation for statin therapy in atherosclerotic cardiovascular disease prevention, and what I'm gonna be prescribing depending if it's the patient follow like a high intensive statin or a moderate intensive statin. So which approach I need to start the patient. And then I go to diabetes, anemia, hepatitis. I have like a little bit of like monitoring patient with diabetes. So what you're looking for. And summary of a glucose lowering intervention. So what kind of medication, the dosage, and the benefits, advantage, and disadvantage of each one. And then we're gonna go to anemia, so the physical examination, what you're looking for, like physical findings, and then a little algorithm about like, you know, microcytic, normocytic, and macrocytic, and what disease can be related to it, and also a little quick, you know, like that, a little quick like written that I did that me and my doctor discussed about also anemia and cause of it. And over here is just laboratory finding of iron deficiency. So it can be thalassemia or anemia of chronic disease. So how you're gonna, it's just a little reference guide to see what you're gonna be seeing the results. And again, so this is a initial evaluation of hemoglobin and hematocrit in adult. And then I'll go to Hep B, which it describes a little bit of IgM antibody, anti-HBC positive, and if it's negative, and about all like the other ones. It's just like so I can quick referral, and if I forget like what I'm looking for on results. And also like interpretation of the hepatitis B serology panel. So it's a little quick cheat sheet over here. Serology response to HBV infection. And that's the same as before, but I think it's more bright. I'm very visual, it helps. And this as well. So me and my primary instructor, we're going over, so I can also refer to. And this I thought was very interesting to have because some drug that could induce like liver injury. So I put over here the list because it's so hard to know, right, which one could cause that. And thyroid, what, you know, cause thyroid, and then types of, you know, problems of thyroid, like Graves' disease or Hashimoto, postpartum like thyroiditis, sorry. And I go to symptoms and sign of each, hypo and hyper, and also a little quick like thyroid gland is explaining how, like, you know, the negative pathway, how it happens. So it's just more a quick reference guide to understand, but you know, to really, if you forget, to go back and see the, you know, pathophysiology of it. Drugs that could cause a hypo and hyperthyroidism, or so I put over here as well. So it's a little quick cheat sheet. The regulation of thyroid hormone production, and that's it. And then I have benign GYN, which I put a little picture of the fibroid location in uterus and how to call it. And then I put some bullet points of uterine myomas and diagnosis, how you diagnostic tests, and what's the treatment. And then I go to men's health, benign prostatic hyperplasia. So clinical presentation, indication of urology referral, and also some agents that associate with urinary retention. So also some drugs that I could refer to, like drugs that could cause that. And then I have UTI that I decided to put it because I noticed that we can see a lot of UTIs on primary care. So this is a little like risk factors, and also clinical definition of UTI, and the microbiology of urinary tract infection. So most cause of we know is E. coli, the presentation, and then image and studies that can be done. So usually like a urine dipsticks, and then you can send to the lab to like do like a urine positivity, like like a urine analysis and culture, and the treatment. So I have over here the treatment for your normal adult as well as your special population, pregnant women and children. And this is also a little quick algorithm. And then I have the study that I really liked reading, just put over here so I can, if I want to go back and read another study. And then I have STDs. This STDs over here, it's from the CDC module. So I decided to actually put in a Word document and always like refer to it. And it has all the, you know, the STDs, PIDs, and you have your syphilis, and I put some pictures of it, of the rash. I think it was pretty cool too, so I can refer to. And then also I have vaginitis, and a little like bullet points of like etiology and clinical presentation of it, and also treatment. And then the miscellaneous, I have the Tanner stages, Ransom criteria, like a little bit of a murmur that I decided to put it in. Also your elevation of white blood cell types and what it could be, like allergic reaction, like monocytes could be an autoimmune disease, protozoa and neutrophils, bone marrow, like chronic inflammation, and so on and so forth. And this one I thought was pretty cool because it gives me the antibiotic group by mechanism, so I can also refer to if I forget about each antibiotic and what it treats. So the key indication, name of the drug, and the class. That's it for my binder, and thank you so much for watching. Have a good day.